The murmur of hypertrophic cardiomyopathy is a harsh, systolic murmur as shown in this phonocardiogram. Listen to a patient with hypertrophic cardiomyopathy. I will begin with 3 normal beats and then add the murmur. This murmur is often loudest at the 4th left intercostal space, but radiates widely across the precordium. Hypertrophic cardiomyopathy is a common genetic cardiac disease occurring in 1 in 500 adults in the United States. Hypertrophic cardiomyopathy is characterized by an abnormally thickened septum, although there can be hypertrophy in the mid-ventricle or even the apex. The obstruction to left ventricular outflow occurs between the thickened septum and the mitral valve, as shown here. The murmur of hypertrophic cardiomyopathy responds predictably to changes in afterload. With hand grip, there is a decrease in the murmur due to decreased obstruction across the left ventricular outflow tract. Listen to the change in the murmur of hypertrophic cardiomyopathy with a hand grip maneuver. I will begin with the patient in the resting position. Hand grip. The majority of patients with hypertrophic cardiomyopathy are asymptomatic, and population-based studies have shown a normal life expectancy for the group as a whole. Listen once again to the change in the murmur of hypertrophic cardiomyopathy with a hand grip maneuver. Hand grip. Despite the good prognosis for most patients with hypertrophic cardiomyopathy, there are subgroups at increased risk of sudden death. In young athletes, for instance, hypertrophic cardiomyopathy continues to be the most common cause of sudden death. When needed, there are a variety of treatments available for symptomatic patients, including pharmacologic therapy, dual-chamber pacing, alcohol ablation, and surgical myectomy of the ventricular septum, as shown here. In summary, hypertrophic cardiomyopathy is a common genetic cardiac disease, with most patients having a normal life expectancy. The murmur of hypertrophic cardiomyopathy decreases with a hand grip maneuver. Listen once again to a patient with hypertrophic cardiomyopathy.